Projects can spark innovation, but not without being anchored in policies. If it's not anchored, then those sparks will die out.
Like with people, many organizations are a bit lazy. They have to be guided, or the garden has to be tended in the way that they grow to that direction.
They have to understand really the importance to cooperate among different politicians of different sectors.
The fact that funded projects need anchoring in ecosystems, because projects by themselves don't scale. Ecosystems do that or enable that.
We have plenty of examples where the right incentives have created new ways of working and created better results. That's a myth that we should bust.
Ecosystems in Health and Care, the THCS Podcast.
Every ecosystem has a heartbeat, but without the right policy and strategy, that heartbeat can fade. Episode 6 of Ecosystems in Health and Care, the THCS Podcast, explores how policies can be designed not to suffocate innovation, but to fuel it. Juha Teperi with Tampere University, Finland, unpacks the policy levers that matter most. Lisa Leonardini, chair of the Italian National Mirror Group Promise, shares how her mirror group brings stakeholders into one room to align national and European priorities. And Joanna Lane, advisory board representative of the THCS partnership from the Netherlands, reflects on how advisory structures can translate local lessons into European strategy. Together, we search for the sweet spot where policy, strategy, practice, and passion meet. I'm your host, Ursula Hessin with Red Swan Vienna, Austria, and it's my pleasure to interview the lovely guests of the THCS podcast. So, Joe, when you hear ecosystems need policies, what's the first story or image that comes to mind?
I was thinking that I was trying to think of metaphorical
Yes,
images, and I thought of a garden. I thought of a
that's
very lush,
beautiful.
verdant garden, but with no gardener. And just imagine you walk into this garden. It's behind a house. No one's ever seen it before. And it's beautiful. It's diverse. You've got plants of all kinds in the garden. They all grow in different parts of the garden. And so there's potential everywhere. You can really see it really excites you. There's potential here. But there's no one looking after it. There's no irrigation system. There's no protection from weeds. There's no seasonal planning. And each plant survives as best it can. And some thrive and grow, and some wither and die. And over time, a garden like that becomes chaotic, imbalanced, and even vulnerable. And so for me, policy is the gardener, okay? And policies don't create the plants, obviously. The innovators, the professionals, the users, citizens, patients, regions, they do that. But without careful, consistent policies, ecosystems lack coordination, protection, and care. And for that, just extending the sort of the garden metaphor a bit further, you need sunlight. And by sunlight, I mean strategic directions, strategic principles. I'd love to see everyone buy into strategic principles which go beyond a political cycle. They need to be long-term. You need water, so that's funding and incentives. You need pruning, because, oh my God, there are so many projects out there that don't actually end. And you need to make hard choices about where to disinvest in order to reinvest. You need fencing in terms of governance and trust. And you also need composting, using fertilizer, learning from failure. I really get annoyed when I stopped going to conferences a long, long time ago, probably before you were born. And I know I'm that old. And I kept hearing these wonderful success stories, but I never heard what didn't work. And that is much more interesting for me to learn from. So my point, I suppose the bottom line is that ecosystems can emerge naturally, but they can't thrive or survive in the long term without policy as a gardener, as the gardener.
Wow, what a beautiful picture. So you, if incentives were fuel in this garden, what kind of fuel is missing right now?
Well, actually, according to the lines Joe was just describing the metaphor of garden, because you made the metaphor of fuel, so I started thinking of space travel, and we tend to think about the rocket fuel, about the 3 or 4 minutes it takes to take the spaceship to outer space. But the long journey is about years and years in outer space going where you want to go, your strategic goal. And there, you can't use rocket fuel. It's impossible. It's something totally else, which is solar wind, which is there to stay for not minutes or hours, but for millennia.
Oh,
or
wow.
even longer
I
time.
love that.
So long term was also mentioned by Joe, and I think that is the most important thing. When cultivating the ecosystems, you have to have predictability and certain stability to it all. So this is all in line. The garden and the space are about the same thing.
Yeah, I agree with that.
What kind of fuel is missing right now?
Yes, is missing, in my opinion, long-term vision capability, co-planning in and across different sectors, in addition to the health sectors, use and good use of good result from the European projects in particular, and in particular, the research projects. Yes, this is my opinion.
And Juha, can you remember a moment when a policy, good or bad, completely changed the trajectory of your work?
Well, I unfortunately can't remember it very well.
Unpack it, please.
Yes. Health and care systems are by definition often very political because the policies regulate so big entities which touch every one of us. They are linked to big interests in terms of economy, of power, and so on. So sometimes the political side of it makes the process very difficult. The Finnish national government was about to introduce a national health and care reform about 10 years ago, creating totally new reformed entities to regions. And I was doing consultancy work in one of the regions, helping them to define the totally new structure for their care delivery. It was fantastic work. We could involve not only the top managers, but also top politicians from the region. And we had a long series of workshops where we first were in small auditoria. Later on, we had to hire a sports entity to house all the people who were involved.
Oh, wow. How many people were involved?
Hundreds. And we were creating this regional goal. And we were like long jumpers, and we had been speeding up, and we were just getting to the takeoff board when the national government, at the final stage of the parliamentary decisions on the new system, took the takeoff board away.
Oh, wow.
Saying we'll cancel the whole reform.
And what happened?
We had only one meeting thanking each other for the months worth of work we had been doing together eagerly, and we were suddenly left alone into a void.
So that's definitely what can happen if we don't have the gardener, right? So can you remember a moment when a policy, maybe good, completely changed the trajectory of your work?
Yes, in Italy, during the preparation of the National Health Equity Program, a program funded under the European Social Fund Plus and the European Regional Development Funds of the current programming period, the government changed it and so did the policy. We had to completely revise in the national program priority on gender issues at the heart of the care. It was a really shame. I can't go deeper, but it was a real step backwards against every principle of innovation and positive change in equity.
Yes, you want to say something to that?
Yes, I can. A long, long time ago, when I was a young director of research and evaluation at a national health agency in Scotland, the new Labour government had come into power, and there was delegated authority from London, and there was a new health minister who was a former neurosurgeon, and this was wonderful. There was interesting things coming out, policies on social justice, and which they actually, because there was no one around the ministers as policy advisors who knew anything about social justice, they went to do a consultation outside. But of course, in the public health field, there were a lot of medics who were policy people. And so they wrote this green paper and it was put out for consultation. And that was fine, but it was obvious it was coming from people who don't think creatively. Anyway, as that was happening, the minister came and visited the agency I was working at and had a meeting with all the directors. And one of the lines he said to us was, "Listen, I know you can give me numbers, but I want to know what the man on the street thinks." Okay, great. So when they put out this green paper, our community settings manager went through a process of setting up consultation all around Scotland in marginalised communities with marginalised groups who'd never been involved in consultation about a green paper before. And this took about 9 months. And it was a lot of hard work getting these people to have a voice. And at the end of the process, what they'd done is they'd set up a big conference in which 60% of the participants were people from those communities. So it wasn't overcrowded with policy people or professionals or that, it was them. And the minister was there and he gave a presentation. And after the presentation, of course, the moderator asked if there are questions. Now, I had been doing some work on a men's health project in Drumchapel. And if you live in Drumchapel, you're probably if you're a guy in Drumchapel, you're fourth generation unemployed, because when the shipyards on the Firth of Clyde closed down in the 30s or whatever, everyone was then unemployed. All the men were unemployed and no one's bothered about them. They bother about women, they bother about children, but they didn't bother about the men. Anyway, this project in Drumchapel, I'd got to know some of these men and we involved them in the consultation, and they came along to this event and they heard the minister speak, and they'd never heard a minister speak before. And the minister said all the nice things that you expect a minister to say. He's got the words, he's been briefed and all that sort of stuff. But for them, the first time they were there where they felt someone in power, they were there with someone in power. And when questions were asked, there were a number of questions went up. And finally, 3 of these guys stood up and they just started venting their frustration at the
Of
minister.
course.
Really venting it, really venting it, really venting it. And the minister took completely the wrong direction with this in responding to this. And he said, okay, I understand what you're trying to say, but you don't really represent the men on the street, do you? And their response to it is, "Minister, we are the effing men on the street." That was an example of crash and burn policy-wise. I mean, the policy worked out, but it was appalling about how these people who had given a lot of their time to do something which was new for them and which has now become more and more frequent about, person-centered care, about citizen involvement and so on.
So it's so interesting. All over the world, we have the same experience. Like, we organized a lot of participation processes in Austria as well. Same experience, like 10, 15 years ago, every minister thinks I should ask the public, I should ask the man on the street. Then they ask the man on the street and they give them answers. And sometimes they vent, right? Because they are angry. And you have to take it, or they give their ideas and nobody does anything with these ideas. That's the worst thing. Because of course they think if you invite me to give you my idea, you do something with it, right? Lisa, we invited you as the chair of the National Mirror Group of Italy. Please tell us what a mirror group is.
A mirror group is a group of experts in Italy that appertain to different organizations at the national and the regional level. They work in the health sector with different capability, expertise, and they can cooperate in order to find common solution and to give answer to the needs of health. But it is very, very difficult, this, because the results are sometimes inconsistent. The principal task is connecting, updating, motivating, and engaging all the actors of the members of the National Mirror Group on the daily basis. So this is a very strong work. Communication is important, and it is necessary to invest in communication. This is the key words, the key component of the common work. And then when the first assets arrive, for example, the investment can decrease because at the point people need to participate. It is not just a matter of contributing, but also to having an effective return for their institution and the priorities of the institution itself.
That sounds like a big challenge.
Yes.
As far as I understand it, the Italian National Mirror Group was created to keep national and European priorities aligned.
Yes.
How do you get people with completely different agendas to stay at the same table?
The coordination of all the people, yes, is very difficult. Yes, it's very difficult because we have to understand their needs, their interest, to try to share the common needs and the common solution. And as I said, when the success arrive, probably we can involve more in deep all the members, but we have to have success in this, to have concrete result of this by this work. Yes, this is the really key, the really way to create a real group. In Italy, we are working on create a national plan in order to create a real governance in the step to participate to the European policies, European activities. So we are working on completing link Italian policies with European policies and create common institutional action in order to participate actively and in a common way to the European activity. We are trying to create this plan, but also in this case, we need the support of policymakers because the plan is a good instrument, a good tool, but this plan has to be implemented with the support of policymakers.
And what do you do to get the support of the policymakers?
We are
next big challenge.
Yes,
I'm sorry, I have all the big
also.
challenges for you.
Yes.
But I think we all would like to know because that's an unsolved puzzle for everyone.
The good start point is to have good technical work, okay? Made up of result of research, result of experience, and result of common innovation. And every day we talk with policymakers in order to transfer the importance of make all the steps in order to work together. This is the only the only type of activity. We have to communicate, we have to try result, we have to share every day, all the information.
So your policy can make or break ecosystems, as we just have heard. The gardener can make or break the garden. What have you seen work and what have you seen kill good ideas before they scale?
What I've seen enable big steps forward is joint ownership. Let me take an example very close to me. I come from Tampere, which is the largest city in Finland outside the capital. And there we have a region or part of the city, Tesoma, which is socially underserved and underprivileged. And the city made a policy to try and intervene the vicious circle of the social development. So to this approach, there was a term coined, and the city of Tampere started calling it an alliance model, which in practice meant that it took the public health and social care providers, the private ones, plus NGOs active in that area, and asked them together to do what they ever can together to raise the health and well-being of that underserved population. What was done was that the aimed outcomes were not only defined, but they were given to all actors together. So at the end, everyone would be reimbursed for their activities with the same rate than the others. So if you achieved or went over the target well-being levels, you would all get 3% or 5% more of the reimbursement. If you didn't meet them, the NGOs, the private providers, and the public providers would get less of the reimbursement. And that created not only an economically effective system, they could produce the services cheaper than was the neutral level of compensation, but the health outcomes were better than the goals and the health outcomes in other comparable parts of the city. And to crown it all, the people were happier than in any part of the Tampere city for those services. So it was making simple incentives to create an alliance that shared the goals, shared the rewards, and started very actively developing all this together. When you go to Tesoma, next to the main shopping mall, there is this House of Health and Well-being, where these actors work together, and you can't separate them. You don't know when you are talking to an NGO people or a public service provider or a private one. And we are really proud of that experience, and it's going to expand. I think you also asked about what can break the good development. I'll be shorter now. I used to be a member in something called National Board for Public Health, which was really about making impact on various kinds of policies in any policy arenas, having an impact on health and well-being. So what we often talk about is the health in all policies approach, which the Ministry of Social Affairs and Health was eagerly promoting. The problem in the board was in the first year of its functioning that no one seemed to listen. So there were people from the traffic, and there were employment ministry people, there were people from housing institutions and so on. And no one seemed to really take notice on the message of the Ministry of Social Affairs and Health until in one meeting, which I remember very clearly, people started saying that we have been discussing this back at our own organization, and we have realized that we could actually do this and start a new policy line which would say that. And there were 2 or 3 guys from various other ministries having this kind of fantastic interventions when the chairman of the meeting said that, ho, 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 now you are talking about things that really belong to the Ministry of Social Affairs and Health. So inability to share is the thing that breaks the ecosystems and the long-term collaboration. You have to invest in trust. You have to be ready to share and do things together, not only on the level of talk, but also in practice.
And what can the Mirror Group do to shift strategies from words on paper to actual action on the ground?
We have to ask this to members of the National Mirror Group. Each member complement the other member, and each member help the other member, because they work on partnership, they work to link policy, but they work to support each other in try and in find solution in the daily work. So I see that they have exchange during their daily activity. This is very, very important. And in my opinion, this is a strong result, a very important result, yes.
What's the most surprising strength you've discovered in your work with the Mirror Group?
I talk on this because I mentioned the plan. We are defining a joint sustainable action plan at national level, going behind the partnership transforming health and care systems, linked with the European policy and activities. And yes, as said, we are working on this with the hope that politicians will continue to support it. We have the support now, but we need the support for the next years in order to the implementation is really.
So, Joe, you'd argued that project results often weaken once the funding stops. What does it take for policymakers to turn short-term projects into long-term transformation?
Well, I think the first bit to that answer is the problem with policymakers is that they're working within political cycles most of the time. And those political cycles are the ministers take notice for the first 18 months to 2 years that they're in the job. And then they're starting to think about re-election. So they get diverted and their advisors kind of, are pandering to their needs. And that's a problem. And then the people who are decision makers in health ecosystems, they're being pushed to deal with stuff in the short term. They're not given any incentive or any way of thinking long term. So they've got to deal with the short term, spending the money, spending it on time, spending it on things that probably sometimes don't need it spent on. And I think we've been trapped with hospitals. And hospitals are a late 19th century, 20th century manufacturing process with inputs and outputs. And that's not how we need to do things. But just coming back to your question now, I think there are a number of elements. First of all, transformation is a journey. It's not a project output. And I think people running projects, even if they're very experienced people, they're just thinking about getting from the start to the end of the project and having a product or a service. But they're not often thinking about the barriers that lie to uptake or scaling of that output, if you like. And so that is an issue. Related to that, obviously, most EU-funded projects are time limited and they're consortium bound. And real world systems, as you said, take years to change. And projects can contribute to that change. The change is not going to happen because of a single project, but they can contribute to that change. Then there's the issue about the decision makers must plan for continuity from the start. And so don't wait for the final year of a 4-year project, 5 years from a 5-year project to talk about sustainability. On projects I work in, you've got to be dealing with that after 18 months because you've got to see what the project is beginning to generate and therefore what you can take forward from it. And you've got to make the connections to be able to do that. There's also, and related to that, I think you've got to embed projects in national or regional roadmaps, in strategies and policy cycles early on. There's also the fact that funded projects need anchoring in ecosystems because projects by themselves don't scale. Ecosystems do that or enable that. And success, I think it depends on engaging long-term actors, the decision makers, the providers, the funders, the users, the regulators, the local and regional authorities. And I think you've got to create transformation corridors that take you from projects to policy. And there is always often people stumble about making science converge with policy, for example. It's a big, big constant issue that I've experienced over 40 years working in the NHS in England and Scotland, and then doing non-profit work in Europe. And then there's another issue, and that is that co-ownership is key. And that's something, there's a lot of rhetoric around it. There's people who do that increasingly. But the question is, to what extent is it genuine? But projects that succeed in scaling usually have strong co-ownership from health authorities, from civil society, and frontline actors. And a project that I'm working on at the moment called Invest for Health, we've been using the concept or stretching the concept of smart capacitating investment. And that's how to do investment in a post-COVID world where the projects learnt the lessons from that. Most of the people have succumbed to their way of thinking from before that. But I'll come back to that in a later question. I mean, I just want to say that projects can spark innovation, but not without being anchored in policies. If it's not anchored, then those sparks will die out. So policymakers, decision makers need to think beyond those funding cycles.
So this brings me to my next question to you, Juha. One of the surveys of the THCS initiative shows a lack of incentives and policy support are the top barriers for ecosystems. If we had one shot, what's the single most effective incentive EU member states could introduce tomorrow? Asking the man on the street?
Yeah, that's a very easy question, as you understand. No, to be serious, there are no silver bullets and no single simple measures that would make the things completely different. So I would take a bit other kind of approach to think of a big thing that in longer term would change things. And that is the idea of many names. We could start with, say, Michael Porter's Rethinking Healthcare book from about 20 years ago, but it has been discussed by many others. Some call it value-based medicine, some call it health-oriented healthcare, whatever. The point is that unlike we are being told, it would be totally possible to create systems where we don't pay for the services, but we pay for the health and well-being that the services produce. And that would be a fantastic step forward. That in practice, these things are being made small scale. There are regions in Europe, there are individual cities that have innovated around this kind of dynamics where it doesn't matter how you produce the well-being for the population, the end result is all that counts. And it makes huge differences. We can't today go to individual examples, but what I want to stress is that we shouldn't buy the argument that it is too complicated. It's doable. It's been shown. It is just that it would make many organizations to change their ways. Like we people, many organizations are a bit lazy. They have to be guided, or the garden has to be tended in the way that they grow to that direction.
So we come to our quick fire questions now. Joe, one policy change that would strengthen ecosystems tomorrow.
I think you've got to move away from trying to change how people make decisions in healthcare providers. You're not going to do that. It's not going to happen. I'm doing that. I'm saying that in the context of health promotion and disease prevention. You cannot unlock the money to the scale that is needed to move upstream, to work on health promotion and disease prevention or risk prediction, because it's all locked into acute hospitals. It's locked into a hospital-centric model. It's locked into the way that that spending is evaluated. You can't release it. You just can't release it. So what I'm interested in, and something that is happening in England at the moment, is community wellness funds.
Can you unpack that a little? What
Yeah,
does that mean?
I'll unpack the community wellness fund. I'm thinking of, for example, West Herts NHS Teaching Hospitals Trust. Through the Invest for Health project, we got to know one of their key directors there. And what they were doing was they were in negotiation with Macmillan, and Macmillan, it deals with palliative care, and I've worked with them in the past, but they decided they wanted to move upstream and delay when people will die and help them be healthier. And eventually what's happened, and it's just been released in the Health Services Journal, is that Macmillan have invested 10 million euros, 10 million pounds into a local social outcome fund or a recyclable evergreen fund for this area. And it's all about active and healthy aging. And they have become, if you like, the catalyst investor, but then that brings in other forms of investment from governments, from local authorities and elsewhere. But what they do is, although they could want to see a return on investment, so fewer people go to hospitals, so it saves money and stuff like that. What they're interested in is if you're able to recycle. So if you like, you generate some return on investment, but you recycle it back into sustaining a project or new related projects. That is an approach which happens independent from a healthcare provider, independent from a local authority. It asks them to work together, asks them to pool resources, not just financial, but also skills as well, and other assets that they have. And for me, for health promotion and disease prevention, that is an example of how to start to invest at scale for what is really needed for impacts in a post-COVID world.
That's a very interesting idea. So, Lisa Leonardini, are you ready for the closing reflections? One policy change that would strengthen ecosystems tomorrow.
The joint planning of policies across different sectors, as I said, it is not enough to lump everything together under the umbrella of competitiveness. It is necessary to understand roles, competencies, synergies, complementation, and mutual impacts.
So, do I could get that right that you mentioned competition among the ecosystems? In what you just said, can you unpack that a little for us? What you meant with a competition?
Yes, competition, because in the market, the industry, okay, all the sector are in competition in order to advance, in order to better create products, better satisfy the clients, okay. The same for the health, not to go to the privatization of the health system. Not, in my opinion, not. The health is public, a real public, very public sector. But we have to organize services. We have to plan the activity, thinking as competition, as create good services in order to create competition, create value. Okay, this is in my opinion. We have to manage our services as a industry, okay, in order to create really good and successful services.
One myth about incentives in health and care you want to bust.
Financial incentives only lead to an increase in the quantity of services without improving qualities. It is important not to generalize the effect of incentives, as their impact depends on their design and implementation. A balanced approach, which considers both the quantity and quality of services, can lead to significant improvement in the health and care sectors.
Sounds really good. Juha, one myth about incentives in health and care you want to bust.
Well, go back to what I said a bit earlier about health and well-being outcomes being the guidance we should use in health and care systems. I've been hearing the same message for 2 decades, saying that no, it's too difficult. not doable. Sounds good, but we couldn't ever pay for the well-being of people. We have to just keep on the services run with the same incentives they are working at the moment. And we have now shown this is not true. We have plenty of examples where the right incentives have created new ways of working and created better results. That's a myth that we should bust.
Yes, absolutely. And my personal experience, I grew up in a doctor's household at the countryside. I learned a lot about preventative medicine. Every young doctor will tell you, yeah, that's good. And we tell everybody you should do prevention, but we do not get paid for prevention. And that's the real scandal, isn't it?
And then one of the things, like in the UK, what was done when this had been discussed enough was to go into paying for preventive processes. It became ticking the boxes, like doing things formally, but not looking at what came out of it. And that's the sort of leap we have to take, not look at the processes, but
Focus
at the
on the
outcomes.
outcome, the well-being, the health of the people, not tick the box. So, one message to European policymakers: why ecosystems are not optional.
A message. I think that first they should be properly explained to them, and then they should be included as a standard tool. The Latins used to say sine qua non. Yes, the impact is very, very important. So they have to understand really the importance to cooperate, but not only among technicians, also among different politicians of different sectors. And this is a crucial point, but I think that in this moment, this is not happen.
Juha.
Look at trends. Look at any trends in European member states. Population, economy, social and health problems. You need transformation. There's no question about that. We are engaged in ecosystems that are very complex. You have to take the dynamics of the ecosystems seriously and create long-term policies that make them not only survive but thrive. Single actors will never achieve the transformations we definitely need.
Yes, we have to work together. And I would like to bring that back again, what you said. We have to focus on the outcome, on the well being, on the health we created. So I think this would be a really good message to European policymakers. What do you think? One message to European policymakers why ecosystems are not optional, Joe.
Ecosystems, I think, are essential, but I've always preferred to work at a subnational level because I think there's more capacity for flexibility, agility, and so on. And what we've got to realize is that even if we look like a small country like Slovenia, there are several ecosystems, health and innovation ecosystems working there. They can work in partnership, you can work across ecosystems. They're basically a catalyst for change, they're a catalyst for implementation, but implementation at scale. And that's really important because you've got to do more than what a single, as you said, than what a single organization can do. Okay. But there's also another issue, and I just want to sort of bring this in here. One of the problems we have with ecosystems, it's difficult to unlock funding for health promotion and disease prevention. But one of the things we need to realize also is that hospitals are not just treating people, they're employing people, they're big employers. You need to encourage them to do local procurement through the local ecosystem so that you have an economic ripple effect in that ecosystem. They need to provide test beds for companies who want to do testing of new products as to advance those new products. So my point is you've got to look to get added value out of all of the players in an ecosystem. But then it's got to have the capacity to absorb that and utilize it in a good way.
Any final words you want to leave us with?
We have to have passion in create cooperation, understanding. We hope that through the partnership transforming health and care system, and through the cooperation among different partnership and different programs. For example, a cooperation with the joint action of the EU for a program, we can understand really the importance of cooperate and use the existing results.
Thank you so much for taking your time, for being so generous, for your expertise, for the wonderful stories, and for the solutions you give us. I mean, we could do that tomorrow, right? Some of it.
Some of it.
Some of it, not all of it. Of course, it's a long-term goal, but actually you have ideas how this could change. So I hope policymakers listen to you. Thank you very much.
Thank you.
Thank you.
You've been listening to episode 6 of the THCS Podcast, Ecosystems in Health and Care, a podcast about the future of health and care in Europe, told through the voices of the people making it happen. Each episode brings together real-world ecosystems and visionary experts who are breaking silos, building trust, and transforming systems. One aligned action at a time, THCS stands for Transforming Health and Care Systems and is a 7-year initiative funded by the European Commission. This podcast is produced by THCS Work Package 9, which focuses on strengthening ecosystems, the key to tackling the complex challenges of today's health and care systems. Because collaboration is not the end of innovation, it's where real change begins. If you liked this, we have more for you. There are 5 more episodes on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts from. See you in the next one. Ecosystems in Health and Care, the THCS Podcast.